Health Insurance Policy Bazaar, Colonel Dr. Sunil Rao, Group COO, Sahyadri Hospital, and Dr. Amit Asthana, Associate Professor. Okay. So, sir, we are live now, and I'll just introduce to all of the panelists. We have Dr. Anupam Karmakar, CEO and Managing Director of Shree Pragati Foundation, Hira Mongi Navneet Hospital. Dr. Rajiv Chhibber, Vice President, External Affairs, SMT. Mr. Siddharth Singhal, Director and Head of Health Insurance Policy Bazaar. Colonel Sunil Rao, Group COO, Sahyadri Hospital. And so the session is moderated by Dr. Amit Asthana, Associate Professor and Head, Department of Medical Devices, NIPER. So I'll ask Dr. Amit to take the charge of the session and flow the session.
Thank you, Ravindra. Thanks a lot. And I welcome everyone. Good evening to everyone, all the distinguished panelists and esteemed colleagues and guests. It is an honor to welcome all of you in this session on technology innovation to bridge universal health care coverage gap. As we are marking the third International Universal Health Coverage Day, it is essential for us to reflect on a transformative power of technology, what technology can do, and how technology can help the healthcare sector. So, universal healthcare coverage, as we all know, is a shared global ambition coined by WHO. Yesterday, myself and Rajiv, we were discussing this, and it promises to give equality to everyone, each individual, without any financial hardness. However, significant challenge remains there, and we had been discussing this in previous sessions, and especially for remote and unserved areas, it is really difficult. So today we will explore how technology innovation and advancement in various fields such as telemedicine, AI, digital health tools, data analysis are breaking the barriers and paving the way to more conclusive healthcare system. And further, if we have sufficient time, then we will have a small discussion about innovative theranostics and advanced surgical technology, which can also participate in reducing the burden and having more affordable universal healthcare coverage. So this session is for exchange of ideas, sharing your insights, and I will be asking you some questions to understand how we can harness this innovation and new technologies to bring healthcare closer to everyone, every individual, and to unserved ones also. So with this, I will start the questions. So, Dr. Rajiv, if it's okay with you, I will take a question first with you. What kind
Absolutely,
of
absolutely.
partnership between medical technologies company and healthcare provider do you think are essential to improve access to life-saving technology to cover the objective of universal health coverage? What do you think? What is your opinion on
Yeah,
this?
it's, am I audible?
Yeah, you are.
Yeah. So thank you, Professor Sana, and thanks, Voice of Healthcare, for this very encouraging session. And universal health coverage is something which, to an extent, is largely championed by WHO. But I now think that India took its own stride with Ayushman Bharat to provide health coverage to a larger, population, and we need to, move this from not only universal health coverage but coverage for all, which means that when we talk about universal health coverage or when we talk about coverage for all, it should not be that it is only a small segment of people who get covered for healthcare services, but it should also not comply to the fact that there is only going to be a limitation when there is a requirement for healthcare. Now, in this, when we talk about the industry and how the industry can actually make a real dent into providing healthcare coverage, it is not through low cost barriers. It is not through the fact that we are providing some obsolete technologies. I think we are now in an area, or in an age where we are talking about how affordability, availability, and accessibility, the three A's that drive universal health coverage, can actually take forward the agenda for providing an access to all. So, put together, it's a very simple aspect of kind of like looking at how medtech companies can participate in universal health coverage, and these are largely with collaboration with stakeholders. Now, when we talk about stakeholders, the stakeholders can be governments, the stakeholders are state governments, are hospital chains that are there which are providing health coverage to a large population, and we develop simple solutions that improve access to care and they strengthen the health system also. As you alluded to, Professor Asthana, that when we talk about universal health coverage, the large part of the population, which is the tier 2 population, the peri-urban population, or the population which is in the rural sector, they also need to be participating in this. So we need to collaborate with stakeholders. We need to offer affordable products and services, and also look at supporting a large health workforce which is largely confined in PHCs, CHCs, and large chain hospitals that today we have a representation of also.
Okay, so thank you, Dr. Rajiv. One very quick question again from your side, then I will take the question, request other panelists also to their opinion. What are some of the key challenges in the adaptation of these new technologies which we are talking about in healthcare system? Have you faced any issues, and how can these overcome the benefits of all layers of society? So I hope you
Uh,
are.
yeah, I get your question. See, in healthcare, and I think all of us as a group will agree that healthcare is a constant improving cycle, whether it is a hospital which improves its services, whether it is someone like a policy bazaar here which will improve a gamut of services that they have, or a company like me which is in the medtech sector, improves the entire innovation of products and services. The key challenge that happens is how is the adaptability towards technology going to be leveraged when we talk about achieving universal health coverage. So unless we have technology available to the last mile, we will not be able to avail that facility. Unless HCPs or healthcare professionals or technicians, they will be able to understand and utilize the technologies that are developing on a year on year basis. uh, we will not be able to utilize the technologies. And unless there is a wherewithal to the general population who will be benefited out of universal healthcare, understanding the utility of those technologies towards diseases that they have, they will not be able to use a technology. So I think when we talk about how technology can help us achieve universal health coverage, we need to also talk about how technology can be imparted, available, and then utilized. So I think technology, while it is one of the boons, but the barrier towards adopting technology is how to utilize technologies. And this we saw during the COVID time also. And we had a lot of issues with technologies being available. Then we would need to propagate how technologies take it forward to a larger extent.
So in other words, I think if academic institutes also come, they can be part of it. They can force, they can train the
Absolutely.
workforce, and part of awareness campaign also. It's
Absolutely. I am a big propagator of a new AI that we need to coin, which is, academia and industry partnerships. unless the academia partners with the industry, or sorry, vice versa, the industry partners with academia, the goal of getting a technology to the right set of people within the government or also within the right set of stakeholders cannot be achieved. Look at how the West has been able to do it, and there is no
Yes.
harm in actually taking it forward in India also.
Great. Thank you, Rajiv. So I will now come to you, Dr. Karmakar. How do you see technology transforming hospital operation to improve accessibility and affordability of healthcare under the universal health cover platform for
Uh,
of India?
uh, Very good evening, everyone. I'm Dr. Anupam Karmakar, so the Medical Director and CEO of Pragati Foundation, Hira, Mongi, Navneet Hospital. And I've having an experience of around 24 years in this field, India and abroad, and have seen a lot of things which you are speaking right now, and have seen situation during COVID. I mean, so the world has seen situation during COVID. How it was happening, what was the challenges, what we did, and in fact, we commissioned the first of the kind COVID center of 1,034 beds at BKC. And we actually saw how technology was being used for accessibility, for the time lags, for the for the betterment of the people. But let me tell you before that, like before we enter into technology, we first need proper drivers of technology. We first need proper technology to be established to be used. Today, what has happened because AI, everybody is into AI, and people are every Tom, Dick, and Harry is trying to make something software of artificial intelligence or hospital management software and are trying to sell it out, which is a real problem. Sometimes the institutes, because of their constraints, they select software which is affordable. But at the end of the day, they land up going just longer. Okay. Second part, I would say about hospital operations. Well, there are a lot of points which I've jotted down, but let me tell you my experience during the COVID. We had established a CCTV system, okay, wherein the team of doctors used to monitor the movement, style, the train, or everything of the, and they never had to, kind of course, they used to go their whole PPE to the patients, but yes, they were constantly under monitor that the patient is doing well or not well, and everything, because we had all the strata of people in that particular place. So that was one thing, and the second part was the electronic health record, which we were maintaining for all the patients and the kind of the treatment which was going, that if we are giving this kind of treatment to this patient, then how the effect is faster, not faster, at what pace, how many days how many days they are going home back. Okay. So we were monitoring to all these things. So this plays a very important role in the hospital operations, wherein the patients are also at ease, the doctors are also at ease, because when there is a pool of huge number of patients, there is a requirement of huge number of caregivers to over them. Correct? And of course, caregivers is not only the doctors, the paramedics, the housekeeping staff, the stores, the laboratory people, everybody, in fact, is important. And they actually can monitor, see, and of course, there was a central person who was basically monitoring all this information taken in this particular area. So, well, I mean, so that was the system which was used at that time. And plus, with the EHR used to mark that what is the kind of treatment going to what patient and how. Okay, so going towards that thing, like I mean, say if you say about technology transforming hospital operations into accessibility and affordability of health. Well, I mean, this was during the COVID, of course, this was a free center wherein all the patients were admitted. But yes, when you go towards healthcare setup, again, there are variants. There are charitable institutes, there are the medical college hospitals, and there are private institutes. Well, I will say everybody has a different ball game to play. I'm sure Dr. Sunil sir will agree to me that how basically we all have to balance our body. Of course, mine is a charitable hospital. We have to balance situations in a different way. But yes, the affordability to the patient is a main concern gamut in our brains. And we, of course, have it in mind very clearly that we cannot charge the patient out of the box. Until unless we have a big investors or donors, not investors, donors. We require donors because since we are a charitable hospital, we require donors who wants to give a good some money for the patient care. And to enhance that care, we will require these kind of AI tools, electronic health records, telemedicine, remote monitoring, to move ahead forward, robotics, mobile health app. These are all certain things that we can do this. Further to that, we can of course we do not want to invest more in the physical form of servers in the hospital. So we go for cloud computing. Wherein we go for a cloud computing, challenges, there is pros, cons, everything for that. So you are totally reliable on a third party for whom you have to, rely to get the data or backend data or anything of that sort of. So, well, those things are there. Now, when I spoke about robotics, you will say, of course, robotics is not a cheap affair. But yes, I mean, again, robotics is not a cheap affair. You have to understand how do we play a volume game and how do we play that in that many cases we can remove the cost of the procedures or the robotics. Correct. And that is how we basically churn out the money, which is also called value-based care models. Reducing administrative burdens through supply chain management, inventory operations. This is a part of, I can say, your HMIS, wherein you can understand. I mean, say, the department will, of course, look into the HMIS, wherein he can understand that this is my inflow and this is my outflow of the revenues. With making departments as the SBUs, kind of through AI tools, through monitoring, through data, through past record, what can be done next? It's something which hospital operations can work into and which can, at the end of the day, I would say, at the end of the day, would be a benefit to the hospitals as well as to the patients.
Thank you, Dr. Karmakar, for your insightful thoughts. Dr. Karnal, whatever sir just now, Dr. Karmakar said, based on that, these new technology, how do you think these new technology, AI, telemedicine, digital health, these platform, how you envision that these platform can innovate or transform the patient delivery care? So patient care delivery and helping achieving the goal of universal healthcare in coming years. I mean, we have to go long way, but some insight into that, what
Sure. Uh,
can be.
Again, I will start by asking whether I am audible or not.
Yes, you
If
are.
Yes,
You
yes,
are
you
very
are,
much,
audible.
very
I
much,
am
sir, very much,
audible.
sir.
Good. And then the second one is that I will start with the thanking Voice of Health, Pinky Char Madam, and various other people involved from Voice of Health for giving me opportunity to speak in this forum, which is based on technology. All of you are expert in technology, but we are working in a hospital setup, which is the playground for all technology people in the healthcare. And the hospital is a place where all communities come together, all types of patients, all types of communities, they come together. And as told by Dr. Karmakar, uh, all of us are aware about use of technology uh, took a real boost from the field from the time the COVID started. And when COVID ended, probably we had already adopted a lot of technology. Whatever was mentioned just now about AI, about telemedicine, tele ICU, and what have you. So many technologies which have come in the medical field. So it's very good on the part of the organizers that they have clearly demarcated within medical field also that one which is operational efficiency, which just now Dr. Karmakar talked about the clinical aspects, about the clinical utility of this, or based on which we can improve clinical outcomes, thereby also touching the base of universal, coverage for healthcare. In that, uh, as a group of hospitals, I can only quote our practical experience in this field. That one number one is about the tele ICU and uh, use of sensor based technologies, which are very helpful for transmitting all these five basic parameters, which are very essential for a doctor to make a diagnosis about the criticality of the patient and then guide the patient accordingly. So, first of all, within the group, we have around now 11 hospitals, which are some of them are of smaller size, some of them are bigger size, and located in different parts of Western Maharashtra. So, in that, it is very useful to utilize the expertise and the knowledge of a intensivist who's well qualified and experienced for those people who are less qualified and less experienced in the periphery, that is within our network. And also, we have a network of small nursing homes who are dependent on us for transferring the case at probably last minute, because they cannot handle certain amount of criticality, and then they transfer. For this, the technology is helping us because of our tele consultation and tele ICU network, which is very, very simple, very basic model which we have taken up is about the camera and transmission of all monitors, which is getting into our software, and our understanding about that from my mobile also. I can see all the monitors which are working in different places. I may not be able to see the face of the patient, and that also is possible. So some of the remotest places are able to send us the parameters which are there on the monitor, and we are able to manage that. In fact, today evening itself, we have one small function in which we are felicitating various people from various nursing homes who are participating in this program. And It is again a AI based diagnosis also comes based on that. Of course, whether
I
to
was
rely
about
on
to ask
that
you the
is a
same
different
thing.
aspect. Yeah, whether to rely on that is a different aspect, but it does throw us the results of the AI based framework, especially the ECGs and the heart rate and various other parameters which we have, based on which some of the things can be picked up by the peripheral doctors, and then they ask queries about this thing. If this is showing like this, should I do like this? All these aspects are practically being done. Another very, very interesting thing which is ongoing, and which will probably pick up more speed, is to transmit the echo. So transmission of echo cardiography from a remote echo to our base place, that is a command center, is becoming very fast. I would say, since we are in private hospital, we also look forward for any complicated cases coming to our tertiary care center and quaternary care center which we have, whether it is valve related abnormalities, which we do have facilities to operate them. We have facilities for in higher end interventions like tower and all that. So it is really helpful in terms of engagement, even if it is not from business perspective, but definitely from engagement perspective, it has become a very good tool for us. Then ECG, I have already explained that very GPs are not able to, general practitioners, which we call in periphery, are generally our BAMS, BHMS people who are also, we call them as a referral universe for us. Referral universe means they should have some place to send their patients, in the sense that whichever they cannot handle. Suppose the ECG is showing abnormality in terms of ST wave elevation. So it is also called STEMI in our language. I'm sure all other doctors also will be able to gain knowledge from that. There have been many projects called STEMI projects in our country, which are also again technology based, in which the ECGs are transmitted from peripheral center to the command center. This actually started first project started in south only in Coimbatore, and then it progressed to various other centers. But in our center, to be very practical, uh, hardly 2 or 3% of the ECGs are abnormal. Though it is an expenditure, but as I said, it has become us with us a patient engagement tool, doctor engagement tool, and the peripheries really feel satisfied that some cardiologist is able to, they are able to interact with and give immediate solutions for their patients. So that one I wanted to say. Another technology based intervention which we are quite favoring that, and in terms of good results, is AI based stroke diagnosis. Again, everybody knows now Mahendra Singh Dhoni has also started appearing for as a brand ambassador for the stroke. So stroke detection is very important. Stroke does get detected, but then after that, if we do an imaging in the periphery, those images, if they reach us in time, then we can guide that patient very well, and immediately the peripheral doctor is also able to understand whether it is a hemorrhagic stroke or otherwise, and send the patient to the higher center. Thereby, even if the patient is getting delayed, a major portion of brain can be saved through doing thrombectomies in time. So all that is again AI based software, very costly. What Dr. Karmakar was mentioning, the another aspect of it is that the cost portion of it. So definitely with the government help and government aid and various NGOs in this thing, all this will become much more affordable and universal. So we do our bit in terms of a private hospital, but there is a limitation to what we can offer to a larger people. There are many companies who have also come up with a very less costly sensors, very less costly sensors, and a very frugal camera and sensor setup, which helps to the tune of, let's say, up to 300 rupees per patient also is there. But 300 is also a very big amount. Many of them are charging 4,000, 5,000, but some companies have recently come up who are charging only 300 rupees. Maybe they just want to increase their sample size in terms of proving themselves. But this is how I thought, especially unique experience, practical experience, what we have about the technology. And then
Fantastic.
I think I will hand over to the moderator.
So
Thank you.
that allow me to move to Siddharth. Siddharth, how these technologies, Siddharth, are you there? Yeah. How these technologies
Yeah, I'm
will
there.
help healthcare insurance for more accessible and affordable insurance for underserved population, especially in context of UHC. What is your opinion?
Sure. I think first of all, Dr. Amit and the esteemed panel, many thanks for giving us this opportunity, allowing us to share our views. It's a privilege to be a part of this panel. See, I think as about the universal health coverage, health insurance plays a very important and a crucial role because obviously to access the healthcare, health insurance becomes the key to avail that healthcare. And obviously in India, which is going to be obviously the largest population, role of technologies in providing health insurance and making it much more affordable, accessible and available, I'm just borrowing from Dr. Rajiv what he said, is absolutely critical. So there are a couple of aspects in which technology is now helping the insurance companies and for example, for us at Policy Bazaar, to make it much more affordable is a couple of areas. One is in terms of technologies helping the insurance companies know the customer better. So now I think health insurance, which earlier used to be only about hospitalization, is now completely a wellness aspect of it. So today the products that come in as a part of health insurance, allow multiple interventions wherein a health insurance company and the customer can be in touch by the way of providing wellness benefits as part of health insurance. When I say wellness benefits, that means if somebody walks 10,000 steps a day, or they take good care of their health. So I think now all these aspects of technology through the mobile app are now built in for the health insurance products. To in fact, there are plans wherein the discounts can go up to 100%. So practically, if you are somebody who can walk 10,000 steps a day, from next year onwards, your renewals can become in a way free of cost. Or I mean, obviously that's a 100% discount, but anybody can get up to 10-20% discount or higher than that if you fulfill certain conditions. I think the broader point is it with the digital health assessments, etc., which are part of the health insurance now and are now easily available across, let's say, either on Policy Bazaar app or on the insurance company end also. So again, provides a lot of opportunity for the insurance company to price the product right, to know more about the customer, and to give the benefit for the customers who take good care of their health, and accordingly make it much more accessible. The second part I would want to touch upon is in terms of bringing the cost efficiency in the entire structure. So, for example, API integrations across. I think the esteemed regulator started one of the projects of National Health Claims Exchange, which is a seamless integration between the healthcare providers, the insurance companies, and customers as well. Is the whole idea is to provide a seamless access and much faster resolution to claims and claim processing, thereby reducing the lot of to and fro's which might be happening currently, and to make it much more easier, one obviously for the customer, but also reduce the cost structure at the insurance company end as well. The third thing I would want to touch upon is the role of AI, role of behavioral analytics, predictive analytics, in terms of controlling fraud. So there could be certain scenarios. Obviously, there's some data about 15% of the claims as a part of the health insurance could be either non-disclosures or could be fraud. So I think there, technology plays a huge role in terms of identifying it, so that the cost structure for the rest of the people can come down. So I think that way, technology plays a huge role. I think the fourth point which you mentioned about how do we reach the untapped market. So I think technology also is enabling a lot of a faster turnaround in terms of the product innovation. A lot of new products that come in have come in because there's a back-end technology at the end of the insurance companies and the distributors to make it available for the for the customers sitting at their home, using their mobile devices, etc., and getting it the access they can with the click of a button. All insurance company products can be made available. And similarly, AI is now being used to make the plans more customizable, because health insurance is slightly I would say a tricky subject in a way, because obviously there are a lot of terminologies which are a part of the health insurance policy. So it becomes extremely important to use technology to make it much more easily understandable for a common man to one access all the products that are at the disposal, and out of the available product, which is the right product for them. So I think that ways, I think the technology plays a huge role across the domain, be it of cost efficiency, be it in terms of knowing your customer, be in terms of fraud detection or control, in terms of early signs of the claims coming in. So I think that ways, with the advent of technology plus the analytics, thereby insurance companies and the distributors obviously will be able to offer a much better price structure to the customers, and hence making it affordable.
Thank you, Siddharth. Yeah, definitely. Colonel Rao, you have already covered this, but I wanted to ask you once more, or you can give more light into this.
Yes.
how hospitals like yours, and also the hospital which are in two-tier and three-tier cities,
Yes.
utilize this technology and overcome the access barrier and extend the quality of healthcare. You covered it a bit in
Yes.
your previous answer, but I we
Yes.
have not talk about the hospitals. We have talked about the nursing home and everything. Hospitals in two-tier and three-tier cities, they are still not providing that much of affordable
Yeah,
healthcare.
yes, you are absolutely right. So what happened was explained earlier during COVID times when the COVID was in full swing. Uh, Somehow the doctors in the periphery and the nursing homes in the periphery. Periphery means I mean to say at taluka place, at village level, all these hospitals which are away from the main cities like Pune. Pune is our hub, and there are spokes which are located elsewhere. So they also developed a new level of confidence in terms of the COVID, and then followed by which, because they were also able to transmit all the vital parameters of the patient through the technology to the bigger centers and take their advice at any given point of time, in the sense that the command center is active throughout in the 24 by 7. So they are able to give you the advice. No doubt the person on the ground is also equally important to provide the treatment on ground, and that much risk is there. But at the same time, the expertise which is not available in periphery gets automatically available through the command centers which are there. So that way, the technology which is being used for tele ICU, that is a system of camera and the transmission system and the software which is able to pick up these things, is very very important in terms of developing a network of hospitals or the healthcare providers, I would say. I won't say, since you have said that don't nursing homes is all right, but there are hospitals in tier 2 and tier 3 cities and tier 4 towns and all that. So there they have a expertise definitely, but a limited expertise is there. So they
Yeah.
just need a that kind of confidence level which comes from the expertise in the metro cities, or in the cities like Pune, which is again a metro city in terms of Maharashtra. I think it is the second biggest city. So like this, that confidence comes in if the technology helps in bringing those transmission. But definitely it comes as at a cost. Many places it is being sponsored by a charitable trust or charitable in terms of CSR, etc. But the maintenance cost and the day by day cost of maintaining that command center itself is quite huge, and then it becomes unsustainable after some time. After some time, it becomes like an experiment. I will be very practical about it. It is not. It is not to be carried on for a longer duration of time. Like in these type of conferences, we speak about it, but that is purely an experimental basis. It is not a norm which has set in, which needs to set in. Then only that universal coverage will come. What we are talking about today. So that is what is my view. But all this is being experimented in terms of actual transmission, whether it
Yeah.
is echocardiography. Echocardiography, as all of us know, is a domain of cardiologists, right? And some of the physicians also do pick up echocardiography after training them. But in the periphery, this particular expertise is lacking. So this expertise is available to you in 100 rupees, 150 rupees. Otherwise, normally echo is charged at around 3,000 minimum in the cities, 2,500, 3,000, depending on the charges. But the same is available now to you, the expertise, in 100 rupees or 150 rupees, if even
Wow.
if I bring down at cost also. That kind of thing, it can benefit all of us in the periphery. So that's what I thought
Thank you,
I
sir.
must
Thank you.
bring out.
Dr. Karmakar, a very quick thought: how hospital can collaborate with these technology provider to serve un, underserved areas, in continuation with what Colonel
So,
Rao.
yes. So I've been hearing this session, and trust me, it's a very wonderful session. And I would say, thanks, VOH, that you have brought the panelists from, Pune and, Mumbai, and, I would say, Sunil sir, and, the other. I would say it's great. You know, uh, from your question is one step, which is a broader aspect from artificial intelligence from the first question, which was into transforming hospital operations, where we spoke more about the AI and all stuff. Here is a little broader aspect. We want to enhance healthcare access to the rural and underserved, whereas we can use technology. So I would say that yes, there are a lot of areas where we can uh, collaborate with technology. Of course, it starts from the first is the electricity, which is the biting situation for us, how we can save on electricity. And yes, there are technological advances, there are capacitors which we can fit in to save electricity. There are kind of devices wherein it catches the movement and gets litted. So these
Yeah.
are technologies which is in a very minute state we can use. And similarly, even for the water, see wherein private players are there, of course it is a burning issue for them as well, because of the cappings and the challenges they face as well, it's more burning for charitable institutes, uh, medical college hospitals, wherein there's a huge number of patients. There has to be a huge cost cutting. There has to be a lot of things in one go has to be done, wherein we have to save a lot of money to give the next care. So, we need technology very very much, and technology, of course, cannot replace human beings, but yes, it enhances the capacity of the whole operations in a better way, in a cost saving manner. Like I would say, we the CEOs, we always see the top line and the bottom line, wherein we have to work that out, that how we can have a little saving, how we can turn centers into SBUs, and so on and so forth. So of course, I mean, say we have to have a very good tele education. We have to first of all educate our own staff that how do we become a part for enhancing capabilities of the institute. If we have
So
those staff with us, then comes next that we educate our customers and our visitors, that how do we have a plus point or a
so
capacity building for, sorry.
Dr. Karmakar, we to save some time, we have actually I got a message that we have another session coming up. So
Okay, so
I would like to take a
basically,
question from Siddharth, and then we will just conclude. Siddharth,
yeah,
how insurance provider and healthcare system can collaborate to enhance and make it more affordable the medical services? What are the critical or expensive treatment? How do you think this partnership can help, and how you would suggest that this partnership should take place between healthcare insurance companies and the healthcare system?
Okay. So I think, Dr. Amit, that's a very, very important question to making the entire system work together. I think healthcare providers, insurance companies, obviously need to work in a collaborative manner so that the entire experience for the customer is a lot more better. Because I think national health claims exchange, which has been has been the brainchild of the regulator IRDA. I think that goes a long way in terms of solving that issue, because right now a lot of the claims processing etc is on a manual format. Obviously there are cashless claims, which is about 60% of the overall claim, but there's still 40% claims which are still on happens on the reimbursement basis. So I think once the two systems or the two healthcare providers across the country through a common platform like National Health Claims Exchange and the insurance companies come together, electronic health records, which I think one of the esteemed panelists spoke about, becomes the reality across So I think in that scenario there will be a much more collaborative, much more seamless, exchange of data, exchange of medical records, medical documents, previous medical history, which will also enable, while a person is applying for a health insurance, so it can be easily accessed through these collaborative systems about the medical history, wherein the customer experiences a very seamless, buying behavior, or at the time of claim also experiences a very seamless way of getting the claim. So I think it's extremely important. Obviously it will take some time to get this enabled, and I think obviously government has a big role to play here to make it a reality, because that platform at a national level is very much required. And I don't see a reason that India, being such a fast developing country, won't be able to achieve it. It's just, I think, a matter of maybe some time, wherein we will be in a position that the information exchange becomes a lot more collaborative, and it'll be easier for the customers. I think, which is the final party to all of us. It'll be much more easier. So I think this is going to happen, but this will enable. And on a cost side also, it will reduce the cost, maybe on the healthcare aspects as well, and on the insurance company side also. I think it will reduce the costs.
Sure. Thank you, Siddharth. I actually wanted to have a concluding remark from all of you, but because we don't have enough time left, I will close this session by thanking you, the esteemed panelists, for
Thank you.
your insightful, in prospective and provoking insight. This remind me also one thing, that technology, though it's important, but collaboration between all of us, um, and commitment from all the stakeholder is very, very important, and that is what came out from this discussion, if I'm not wrong. So the few key points you all will agree from this is that partnership between healthcare providers and technology innovators, and also insurance companies must, to enhance the gap, to reduce the gap between you know the current universal healthcare system. And of course, Dr. Rajiv, in fact, probably left. Role of affordability in scaling up manufacturing is another aspect which need to be seriously taken care, and opportunity to learn from global best practices and adopting the unique um, challenges which we have from there. It's quite important. So I hope all of you agree. If you have some point quickly, maybe you can put in, and then we can close this session completely, and then I will go forth with vote of thanks.
Yeah, I think I just wanted a very quick point that the collaboration in terms of hand holding by the people who are offering the technology
Yeah,
in the long term is very important. What is happening now with us in the private hospitals and other hospitals, that the technology is provided, and then the support is not there after that, and every time the cost is keeps increasing, then it becomes very difficult for the healthcare providers like us to maintain the technology ongoing,
true.
uh, and many of them
Very
wind
much
up.
agreeable. Very much
Yes,
agreed.
yeah. So that I thought must be point must be made.
Absolutely.
So I
Thank
Very
think
much
with
agreed.
that, I want to conclude this session and would like to thank. I would like to express my heartiest gratitude to organizer, Voice of Healthcare, to provide us all the platform to discuss this, and to supporting partners like Association of Healthcare Provider India, UN Global Compact Network, and Association of Indian Manufacturer of Medical Devices, IMED, and also KRIA, for their efforts in creating a platform and meaningful dialogue. Though it was a very short time, we would have even more time to discuss all these things. But it was a great platform. I also want to thank our audience for their engagement and enthusiasm. Your presence inside highlight the collective drive to bridge the gap in healthcare through innovation. And thank you once again, everyone. And I look forward to seeing positive changes in our uh, from our dialogue, whatever we have discussed. Thank you, everyone, and I'm handing it over to Voice of Healthcare to take it further. Thank you very much, all the panelists.